So we'll walk through a variation of pad placement for a tight hip. We're with Chris today and Dr. Tim Brown. Anytime that you're going to pad someone up or anytime that you're going through the process, we like to check before and after so that not only the patient or the athlete, but yourself can get an idea of the results that you're getting with the device. We're going to start the device, so you press the power button on the top, let it boot up, and then we're going to do a little kind of test with Chris's hip just to kind of see which hip is tight, which one we're going to pad up. And then let's just have you cross, and I'm not going to tell you which one, I'm going to let you choose yourself. Cross one foot over the opposite knee and get a sense of which one feels tighter, feels more restricted as you're going through that motion.
Left feels tighter.
The left one? Okay, all right, great. So right now, with the device, we're at 250 as far as the frequency goes, which is the frequency which will allow you to relax and release muscles that are tight. We're going to activate the two channels, so you press the two buttons. For channel 1, channel 2, we're going to tap the large button that says off, so it's turned to operating. We're on normal polarity right now, and then we're going to take the pads, and with hips I like to place the pad facing down with the lead wire up and use the pants in order to hold the pad in place, as opposed to trying to drop the pad and feed it all the way through. It's up to you, but that's just a preference for me. So I'm going to go lateral aspect of the hip and then pad a few inches away, and then we'll go red next to the other red. Okay, so here's one variation, and then you can alternate them as well. So I'm going to ask Chris, let me know the first sensations of stimulus that you feel. That's a 1. We always say on a scale of 1 to 10, 7 is where you tell us enough's enough, and we probably want to operate in the 4 to 5 range. But right now, we're just looking for a 1, the first sensations of a stimulus. So you've got the knob on the bottom, the larger knob, which takes you up by 3% at a click, and then the smaller knob on the top that takes you up by 0.5% at a click. And so I'll start with the bottom knob. Let me know first sensations.
Okay.
Okay, so we're at a 12. From there, then I'll use the fine adjustment to take him up from there just so that he feels comfortable with it. So from here, let me know when we get to about a 4 or 5 as far as the sensation of stimulus in the hip and under the pads.
Okay, that's probably about a 4 or 5.
Okay, great. So then let's just have you have a seat, slide out to the edge of the table, cross that foot back over, and then let me know if that stimulus is too much with regards to what you're feeling in that hip as you're stretching it.
Not too much. Could probably go a little higher.
So this is a great example of the test also being the exercise or the stretch. Chris says we can go up a little bit, and your body seems to acclimate to the stim after a few seconds, so let me know.
Probably good.
Good, right there, okay. Go ahead, sit up straight, and then just a little bit of pressure into the top of the knee, just to increase that stretch, real gentle. And then keeping the back really flat, just a little bend forward, real slight, just to increase that stretch a little bit. Do you feel that stretch increase?
Yeah.
Okay. And then we'll hold that for 5 seconds, 10 seconds, 20 seconds, 30 seconds, and then release. And then do that 3 to 5 times.
So you're increasing he's increasing his own intensity by doing this stretch. And by increasing the intensity, it's actually making the device help you even more.
Right.
Great.
Yeah. Yeah, and you can feel it when you activate a muscle. You know, the second that you voluntarily fire that muscle, you can feel the stimulus underneath increase as well, which is great. But at this 250 frequency, you know, we're tapping that area 250 times a second in attempts to release and relax and open up that hip.
This is where the sensory and the motor come in. So he's treating the motor effect of that muscle shortening through the sensory system. And by treating both systems, you allow the nervous system to be involved and actually kind of rewrite the script for the nervous system. So if you've had a muscle that's been chronically tight for a long time, this machine or this device comes in, and because it works with both the sensory and the motor systems, you're able to actually rewrite that motor pattern or rewrite the muscle memory and create length. And what I've noticed is in my practice is that my treatments last so much longer because we're treating both systems. I'm not just treating the muscular system, but along with the machine, we're treating both those systems. And I think in parallel, they work very well together.
Yeah, that's great. Yeah, and once again, this isn't a substitute for medical advice. This is for a generally tight or immobile hip. You want to make sure that you talk to your practitioner or your health and fitness professional to make sure they don't have pain from a disc, there isn't something else going on. This is just general recommended pad placement that I'll use for a tight hip. And so now this is also a great example of the test being the stretch, also being the exercise. So if we wanted him to do a single leg quarter squat or just a full body squat, and we wanted to add load to the device, we would drop the frequency from 250, say, down to 180, and then have Chris do a few reps of body weight squats. to now activate that muscle and add a little bit of load. So let's have you do just 5 reps at 250, just bodyweight squats. Great, so we're getting some range of motion as he's going through that movement. From there, the next set, we'll drop that load to 180, or that frequency to 180, to actually add some load to the muscle.
I was just going to say, though we're treating a muscle, we're actually treating that muscle through movement. So we don't really isolate just that muscle that we're focused on, but we actually engage all those muscles in the chain of movement, which for me is very unique in a device that allows you to do that. In most stimulation, you only get one current. It's an AC current. And what happens with that is when we get into a position where the muscle contracts more than when you put the pad on, it'll actually take that muscle into a heightened sense of tone and create tetany in the muscle. And that really creates a difficult arena to create a functional protocol.
So now we're at 180. Chris, let's have you just do a couple reps of bodyweight squats and let us know kind of the difference that you're feeling versus at 250.
It feels a little more kind of tremoring, or,
Okay.
or like
Yeah, you're getting-
vibrating, like buzzy, I guess.
Okay, great. Yeah, and so the 180 we feel is potentially a good combination of you're getting some increased activation, but still getting some great range of motion. And then you can continue to drop the frequency if you want to add more load. Once again, as with anything else, you want to ease the athlete into the process, so you don't want to overdo it. And important to remind them, while it may not feel like you're doing a lot of work, you're doing a lot of work right now. So even though it doesn't feel like you've got 300 pounds on your back, you want to make sure that you gradually incrementally build to the place where you can take that stimulus. And then typically we'll end with a set at 250. We'll go back up to 250 and now go ahead and go through the range, just like you would want to create range and flexibility at the end of an exercise, so the muscles are restored to optimal length. They can act as a pump to bring in blood, oxygen, nutrients, flush out waste products, and allow the patient, the athlete, to recover quicker. All right, Chris, so go ahead and have a seat. Let's run through that stretch again. Now that we've done a few exercises, so slide out to the edge of the table. Let's cross the foot over. Keep the back really flat. Protect the back. Once again, if you're not a health and fitness professional and you've got something going on with your hip or your low back, make sure that you consult with someone before doing this. So now we're going to turn down the stimulus. Go ahead, drop your leg for a second. And now let's bring that leg back over just like you're doing that stretch. And let us know what you're feeling.
Feels like the tight spot shifted, like it's no longer where the pads are, but it's a little further down. So
Okay.
It feels like that changed things.
Great. Yeah, try this out. Let us know if you have any questions.